So let's look at the associations between weight and height. Despite the leveling off of weight in recent years, serious language has been used to scare the public into trying to lose weight. We have declared war on obesity. They tell us there's an obesity plague in America that costs the nation as much as $147 billion and an untold number of lives every year. Okay, this was a statement made on CNN's One Nation Overweight. So terms such as declared war and obesity plague or obesity epidemic have been used. Statisticians and economists have attempted to put a price tag on this epidemic based on statistical associations between weight and health. So we've all heard that obesity is associated with many serious diseases, including heart disease, stroke, type 2 diabetes, and certain types of cancers. And these are some of the leading causes and are the leading causes of preventable death, they tell us. So here's when it says diabetes has increased dramatically over the past 20 years. That proves that diabetes is caused by global warming. Okay, so we hear that and we go, oh my gosh, well, no, that's a stupid statement. And yet, that's pretty much what we are being told. In order to understand the real story behind the obesity epidemic, you have to first understand the difference between association or correlation and causation. So we know that global warming does not cause diabetes. Okay? But these are some things that they're trying to put together in regards to weight and our health. So a correlation simply means there is a connection between two or more things. So male pattern baldness is correlated to heart disease, but it doesn't mean that male pattern baldness causes heart disease. Okay, so the correlation just implies that there's simply a connection. All right, so it doesn't mean that that it's caused by that. So once we determine those things, we have to look at those things. We can't just assume that somebody eats sugar, therefore they're fat, or somebody eats fat, therefore they're going to be fat. We can't make those statements. When the CDC uses the term obesity-related conditions, okay, we could substitute the term correlated or associated for the word related. Obesity doesn't cause these conditions of heart disease, stroke, type 2 diabetes, or certain types of cancer. And it's not necessarily causing things that are among the leading causes of preventable death. Okay, so we have to know, are we looking at correlation or causation? The problem with making association between weight and health is that there are often other factors that could contribute to the disease, with weight being only one of them. Okay, so you have all of these things. An epidemiological studies don't typically control for fitness or activity, nutrient intake, socioeconomic status, body image, so how do you feel about yourself, weight cycling, which is associated with inflammation, hypertension, insulin resistance, hyperlipidemia. So weight cycling is yo-yo dieting. It's where you lose the weight and then it comes back on. Let's look at this People magazine of Paula Deen. She was diagnosed with diabetes and then 4 things happened. 1, she received medical care. 2, she doubled up on veggies and began using healthier cooking methods. 3, she began walking every day and she lost 30 pounds in the process. So her diabetes improved and she feels great, but why? Well, we don't know if any of these, which 4 was the one that caused her to feel great and her diabetes to improve. It could be any number of those. But if you're going to look at correlation, we might as well look at this graph. If obesity is killing us, then why is life expectancy on the rise? Isn't that a great question? Of course, there have been many advances in medicine that has resulted in increased life expectancy. But this graph suggests that obesity is not the killer that media suggests. In fact, if you look at the BMI and life expectancy, it turns out that the lowest incidence of death is actually in the overweight and obese categories. I'm just going to give it a moment for that to soak in. Okay, so BMI between 25 and 35 has the lowest incidence of early death.